Hi, and welcome back. In this video, I am going to talk about gonorrhea. This is the second most common bacterial sexually transmitted infection or STI in the world. In the previous video, we talked about chlamydia, which is the most common bacterial sexually transmitted infection or STI in the world. We also talked about vaginal thrush or yeast infection, bacterial vaginosis, and trichomoniasis in previous videos. You can access these videos by visiting our page. Please don't forget to share our videos with others so that we can reach more people who can access this information. Gonorrhea is a sexually transmitted infection or STI, and it is caused by bacteria called Neisseria gonorrhoeae. It is the second most common STI after chlamydia in the world. Gonorrhea bacteria is mainly found in penile discharge and vaginal fluid, so it can be spread by having vaginal, anal or oral sex without a condom. It can also be transmitted through sharing sex toys such as vibrators that haven't been washed properly or covered with a new condom when used. The main symptoms of gonorrhea are a thick green or yellow discharge from the vagina or penis, pain on urination, or bleeding between periods in women. It should be noted that almost 50% of women and 10% of men with gonorrhea do not have any symptoms. Gonorrhea can infect the cervix, urethra, rectum, and rarely the throat or eyes. It is important to know that gonorrhea can be passed from a pregnant woman to her baby. Untreated gonorrhea in pregnancy can cause serious complications in the newborn baby, such as permanent blindness. Pregnant women with suspected gonorrhea should be tested and treated before the baby is born. Gonorrhea is diagnosed with a swab test of a sample of discharge from the vagina or penis. In men, a sample of urine can also be used for testing. Gonorrhea is usually treated with a single injection of antibiotic called ceftriaxone. If injection is not available, it can be treated with a course of oral antibiotics like azithromycin. The symptoms should improve within a few days of starting treatment. It is advisable to have a repeat test a week or two after treatment to ensure the infection has cleared. Contracting gonorrhea does not provide lifelong immunity, and it is possible to catch it again. It is advised to avoid having sex until the treatment has been completed and there are no further symptoms. Untreated gonorrhea can lead to long-term serious complications such as pelvic inflammatory disease in women, or infertility. Pelvic inflammatory disease is an infection of the uterus, fallopian tubes and ovaries. Gonorrhea bacteria cannot survive outside the human body for long. It cannot be spread by hugging, sharing baths, towels, cups, plates or cutlery, or from toilet seats or swimming pools. If there are symptoms suggestive of gonorrhea, it is recommended to have a test and treatment as soon as possible. Please note that this is strictly for educational purposes and is not intended for a formal diagnosis or treatment in any way. No medication or remedy should ever be given to anyone without consulting a doctor and checking for allergies first.